ICMR. Now may I kindly request you all to please.
It's a great honor for us to have Dr. Jitendra Singh with us today. As you all know, he is one of the most important ministers in this country, and he is also from this region. In fact, some of you will be probably pleasantly surprised to know that he was supposed to be the principal investigator of Jammu and Kashmir for this particular study. But it was at that time that he actually became a minister.
You didn't know that I would become one.
I didn't know at all. So he would have been presenting these results. But it's very appropriate that when the results are finally being presented, he is here, not in the capacity of principal investigator, but as a Minister of the Science and Technology of this country. I don't have to introduce Dr. Jitendra Singh to you all because he is a son of the soil here. But just for formality's sake, he completed his MBBS from Stanley Medical College, so we can claim that he is actually from Chennai. And then he did his MD in internal medicine and then fellowship in diabetes from All India Institute, Delhi. He was conferred MNAMS, he was conferred FICP, and he has served as professor of diabetes and endocrinology here in Jammu in the Government Medical College. So he is actually a colleague of all of you all. And some of them have done well also in politics. I won't say they've not done well, but rarely has done it. And subsequently, he has been elected to the 16th, 17th, and 18th Lok Sabha from Udhampur constituency. And for the last 10 years, who has risen to such heights, and they are always trying to put down India. So they called and they said, India is finished now. India is finished. So what do you mean India is finished? Oh, you have 101 million people, that's more than the entire UK population, you have only diabetic people. Then you have another 136 million, like half of Europe you have got, only diabetic, you are finished, you are finished. I said, sir, with due respect, if you can do a study like this and complete it, which you have never done in your country, we know also how to take care of those people. Our government and our people will do it, so you don't worry. So you mean to say that you don't have a problem? We have a problem, but we know how to solve that problem also. We won't do a study like this and leave everyone like that. India is great enough, sir, for you to look after. You worry about your country, you don't worry about India. We will take care of our people. So that's the kind of excitement which created. 87 newspapers wrote about it. So you can imagine the kind of interest that it created. So 7% for diabetes, pre-diabetes is 15%, and that's why we have 136 million. So we have a large opportunity here to actually prevent diabetes in those
So, on behalf of Dr. Jitendra ICMR and Secretary Department of Health Research, Dr. Rajiv Val, we thank you from our heart that you took your valuable time in addressing the gathering and participating in this study of Jammu. I said that when we started the study, because we have been asked from Parliament and we are getting small reports that our diabetic population is increasing. So with that we started, and there was a lot of criticism that time also that how such a big study is possible.
Dignitaries and the dice, sir, it's a wonderful occasion to unveil the data, sir. In our country, what we lack is not the number of patients, the number of experts. Money, you told there's no dearth of money, but only there is definitive data, authentic data. And many times the data which we present is not honored because it is not properly collected. And now the things are changing actually. And as you told this data about diabetes, I've been told that the total number of diabetics in the country are more than the population of Brazil. And you told correctly that we have our own set of problems to take care. I am an oncologist, sir, and similar problems I am facing about the data. And recently in 2014, we started a hospital-based cancer registry with the help of ICMR, which is running wonderfully well. And on a daily basis, all data that the patients we are seeing is being transmitted online to NDCIR at Bangalore. And we are proud to say that our data is now being quoted in many national and international journals. And it's
put it across to the state government here. We have taken it up in a big way at the central government. A huge push to the private-public participation. I think that could come in something like government medical college. We should not be hesitant in involving the private sector. At the same time, private sector should also follow some of our priorities. For example, if they are opening up a new corporate, they can open up a small ancillary branch in the rural area. So that is how it would work. Because if earlier on, and this government is quite open, and thanks to Prime Minister, because earlier on there was a lot of skepticism between the private and the public. The public sector always thought of the private sector as black marketeers, policers. The private sector thought of public officials as bribe takers, as scammers. So there was so much of skepticism. So I was the other day addressing a student, I said, when you board a bus, because now there are better means of travel, but in our times it's mainly the bus. तो उस बस में महात्मा भी बैठता है, गुंडा भी बैठता है, चोर भी बैठता है, डाकू भी बैठता है. So you have sadhu sitting there, you have shaitan sitting there. You have sinner sitting there, you have virtuous sitting there. But suddenly when the bus breaks down, the tire gets punctured, which used to happen very often in my and your times, then what does happen? Everybody gets down and starts pushing the bus. They forget who is each other's vices because the destination is common, the objective is common. So if we have to achieve this objective, achieve this effectively, we have to give up these barriers of the public-private. And why I am saying so is that we have walked the talk. Just about 3 months back, we came out with the National Research Foundation through the Ministry of Science and Technology. Also, we are the first in the world, among the first. Only America had one, that is called National Research Society. Germany has one. We have come out with a better version. And very consciously, not only 70% of the resources from the private sector, we have also given representation not only exclusively to the scientific fraternity, but also to humanities, to social groups, to also human resource development, who can give a flavor of our culture, our context, while planning our scientific programs, who could also design our project structure befitting the requirements across the world, and also could advise on what kind of collaboration do we have. Because if we are thinking of Viksit Bharat, easily said than done, then we have to live up to global challenges. We have to have global parameters. We have to have global strategies. And there also we have started making headway. We were in Global Innovation Index, we were just 81 10 years back. Now we've jumped 41 places. And startup ecosystem, we were nowhere. Today we are ranked 3 in the world. So that means we have the capacity of doing so. There was possibly not enough of support from the levels of the policy makers or the government, which is now happening. And therefore, from the point of Jammu and Kashmir, I think this is also one of the better times happening, because I can foresee that J&K hereafter is going to contribute to the overall growth story of India. And as I said, I am not saying that without evidence. The point is, when we talk of rising to that pedestal 2047, most of us talk like politicians, most of us talk like public speakers. But when we talk of it as scientists, how do you rationalize it? Going haywire. But in COVID, we did better than many other economies which are just having 500,000 population. And therefore we proved it. But now, how do we reach that 2047 pedestal? Now we will have to explore all those resources which have remained either underexplored or unexplored. And those resources will come from regions like Jammu and Kashmir. To my mind, we have two main vast resources which have remained unexplored by the earlier governments. One is the marine resource. We have 7,500 long kilometer coastal area beginning from Odisha, Bengal here up to Maharashtra, Gujarat. And it's a huge wealth of metals, minerals, biodiversity. Otherwise, the other day I was telling a civil servant, I said, very soon you'll have to have a secretary for illegal mining in the seabed. And we have started that deep sea mission. Prime Minister spoke about it for the ramparts of Red Fort, though people have not yet realized it, because when the results start coming. So the value addition to our economy is going to be there. Because all other sources, IT, etc., exhausted. Other is going to be our Himalayan resources. And those states, territories will lie in the bed of Himalaya. Whether Jammu Kashmir, Himachal Pradesh, Uttarakhand, Arunachal Pradesh. Already we've started, Aroma Mission started from Jammu and Kashmir. A new genre of agri startups in the form of lavender cultivators has emerged. It's become popular all over the world. Prime Minister spoke about it in Man Ki Baat also. And therefore, I think the findings of the ICMR India Diabetes, I'm sure media will be kind enough to give it due coverage. And I would also request, and we will also do it, we'll prepare small clippings for social media. Because we have seen that even many of the scientific work doesn't find enough slot in the media, but the technology is so strong that we don't need it. We conducted a longest ever coastal cleaning campaign in 2022 in the world. And we had our own studio set up and our own clippings because people are watching just 2 minutes video or 30-second reel, which you can produce better. And the access is through that. So we can generate awareness. We can generate awareness through infographics, through information dissemination. Also, these are some of the lesser known facts. And of course, with the kind of access and influence that Dr. V. Mohan has across the society, that could be an asset to all of us. And I think my only hope is that we are able to pick up the right kind of cues from the presentation made by Rajiv, also take the right kind of measures and succeed putting Jammu and Kashmir in the main course of the mainstream journey of India, both in healthcare as well as in adding to the economy. And the two are very closely interlinked. And that's why I said it's not only a concern of those few in this room, it's a wider concern. And I'm sure each citizen will be able to contribute. That's exactly what is being envisaged when we talk of the Gold India 2047. Thank you very much for the patient के चेयरमैन हमारे बीच हैं और इनकी पहल से एक देशव्यापी डायबिटीज का एक स्टडी का शुरुआत किया गया था जो विश्व की सबसे बड़ी स्टडी है और आईसीएमआर के सौजन्य से उस स्टडी को मुकम्मल किया गया। आईसीएमआर इंडिया डायबिटीज स्टडी और इसके जो आंकड़े निकले हैं, जो इसका डाटा निकला है, उसका बड़ा व्यापक तौर पर उसका प्रकाशन हुआ है। उसको संबंधित संस्थाओं ने उसका संज्ञान लिया है, किस प्रकार से आने वाले समय में डायबिटीज की रोकथाम की जा सकती है देश में। उसको अलग अलग चरणों में उस डाटा को रिलीज किया गया। दक्षिण भारत का डाटा पहले से रिलीज हो चुका था, उत्तर भारत के कुछ प्रदेशों का हो चुका था। अब जम्मू कश्मीर की बारी थी, तो हमारा ये सुझाव था कि इसका जम्मू का डाटा जम्मू से ही रिलीज किया जाए। आने वाले समय में फिर कश्मीर और लद्दाख का भी रहेगा और उसमें जहां पर कि ये पाया गया कि कुल मिलाकर के देश भर में लगभग 16-17% डायबिटीज पाया जाता है। जम्मू के 10 जिलों में उसकी औसतन लगभग उतनी थी या थोड़ी ज्यादा थी, 17-18 तक। तो जो एक विषय ऐसा है कि जिसका संज्ञान लेकर के आने वाले समय में हमें रोकथाम के कार्यों में भाग लेना पड़ेगा। हमारा गवर्नमेंट मेडिकल कॉलेज जम्मू भी इसमें सहयोग कर रहा है, ऑल इंडिया इंस्टीट्यूट मेडिकल साइंसेज जम्मू भी इसमें सहयोग कर रहा है। बहुत जल्द हमारी नई सरकार बनी है, उनके साथ भी इसकी चर्चा होगी और मैं ये चाहूँगा कि जो गैर सरकारी अदारे हैं वो भी इसमें अपना योगदान दें, क्योंकि डायबिटीज इज टू सीरियस टू बी लेफ्ट ओनली टू गवर्नमेंट। ये हमारा एक राष्ट्रीय दायित्व है। जैसे बार बार प्रधानमंत्री मोदी जी कहते हैं कि सन 2047 विकसित भारत जब उस शिखर पटल पर पहुंचेगा और हम अपना शताब्दी उत्सव मनाएंगे, तो वो तभी संभव होगा कि प्रत्येक नागरिक अपनी भरपूर क्षमता, अपनी भरपूर ऊर्जा से उस शताब्दी भारत के निर्माण में, उसकी रचना में अपना योगदान कर सके। और जब युवावस्था में डायबिटीज जैसे रोग हों और उसके साथ संबंधित रोग हों, तो युवाओं की ऊर्जा, उनकी क्षमता बजाय राष्ट्रहित के कार्य में लग पाए, दूसरी तरह से कहीं जाया जाए, इसके लिए और इसकी रोकथाम करना यह हम सबकी एक सामूहिक जिम्मेवारी है।